Hello Vivek, thank you very much for talking to us on medicine in a nutshell. You're at the University of Edinburgh, is that correct?
Yes.
And you're a medical student now in your penultimate year?
Yeah, calling it fifth year.
Calling it fifth year,
Mhm.
excellent. And you're calling it fifth year because you have intercalated.
Yeah, that's right.
Okay, good, that's fine. So if you don't mind, if I can take you back to when you first went, if you can remember, from high school into medical school.
Yep.
What was that transition like for you? What words of advice have you got for people who may be making that transition?
My transition was fairly abrupt. I wasn't sure I was going to med school straight away at that point, and I was just I got my results on the August, and in the September I was going. I think the words of advice I'd give is be prepared to not have such a didactic form of teaching involved. It's a case of you going to lectures and reading stuff by yourself, whereas as opposed to in your classrooms where you had a teacher who you could interact with during the time. This is more lectures and problem-based learning yourself as opposed to teaching.
So are you saying that when you go into medical school, you're sort of left up to yourself to decide how much studying you're going to do, essentially?
Pretty much, yeah. So you do as much studying or as little studying as you feel is necessary. You need to strike the balance between your work life and your playtime as well, I suppose. So meeting other people, doing societies, things like that. And that kind of encompasses university life, your work, and the things outside, your extracurricular activities.
So, but other than being a medical student, you were a university student.
Yeah, that's
so
right.
Let's concentrate a little bit on what sort of things did you do? What sort of thing could you do in university?
So at university, I think the first thing that you notice is that there are probably about 1,000 societies that you could join. Everything from baking to charity to academic societies. I quickly joined a charity society, and we spent time raising money in innovative ways for medical charities, because we were a set of medical students who were doing that. You do also spend a lot of time just interacting with everyone, meeting new people all the time. Freshers Week is especially good for that, because everyone knows that nobody knows each other, so it's very easy to meet and form friendships and things like that in the first week.
And you did say that you have to sort of work out how much studying you're going to do, and so was there a lot of studying in first year medical school?
Not as much as the later years, but there was definitely more studying than in the previous years in high school. I think in high school you kind of get the sense that you can learn everything on the course, and then that would be okay for your exams. But in university, it's a kind of bottomless well of information. You have to learn at what point do you say, okay, enough's enough, because I don't think you can ever learn everything that they're possibly going to ask you on.
And in your first year in most medical schools, it's very much a sort of lecture based or rather non-hospital learning. Is that correct? Mainly.
I don't think I would say probably 50-50. Some universities do throw you in the deep end pretty quickly. My university and many others like Aberdeen, Cambridge, Oxford, Imperial, I think even Newcastle, they kind of have a more gradual phase into clinical learning.
Okay, so and then you sort of transition as you're now sort of in your penultimate year. You've now gone on to predominantly clinical.
Yeah.
And how is that? How is that different? What do you do that's different? How's your experiences and such like?
So in first year, I'd spend maybe the first 3 hours of my day in lectures, and then the rest of the time would be up to me to study or not study, depending on how I felt that day. In clinical, it's completely different. You go on towards, you have to make your own time or follow clinics or tutorials, things like that. You follow the doctor's rota and what they want to do. You spend your time doing much more practical things on the wards, like taking bloods or doing urine samples and things like that. You learn much more practically. and you're out there doing things in a much more formal setting, talking to real people, and it's not just the theory of it all. It's the actual practice that you practice while you're there.
And do you find that more enjoyable than in your early years?
I'd say so, because there's that human element to it. You get to talk to interesting people, and you learn a lot from, not just the doctors, but the patients themselves. You learn a lot from them, so they often have experiences that you can draw back on later, and they have unique perspectives on things that are important for you to learn. So just having the chance to chat. As a medical student, you get basically unlimited time to chat with the patient, so they basically tell you everything, even if they don't tell the doctor, because you can sit and talk to them for 40 minutes, 50 minutes quite easily.
And do you find when you see patients who may have a certain condition that you may have read about, does that help you understand the condition more? Does that help you remember things better?
Yeah, absolutely. So when you're in an exam and you think, oh, have you seen someone with heart failure? So you read about heart failure before you go in, and then you go in and have a chat with somebody. And then in your mind there's like a tick box that goes through, and you just think, oh yes, they have this symptom and that symptom and that symptom. And then when you go to the exam, you think, yes, I remember Mrs. Smith who had heart failure, and this is the treatments that she was on because I saw her cardex and I asked her. And so these cases tend to help you remember things a lot better by putting that little human touch into it. It makes it a story.
So your seamless transition from the lectures based to the more clinical based was sort of interrupted by going out and doing lab-based research when you intercalated. Is that correct?
Sort of, yes. So our intercalated degree, we went into the final year of a biomedical degree, essentially. So I did neuroscience. And the first half was kind of lectures and tutorials, and the second half was focusing on my dissertation. And mine was very heavily lab-based, so I was in a lab with a physiology student, and we were looking at how the brain functioned. That part is mainly lab-based.
And do you think intercalation, other than, of course, getting this extra degree, do you think that's sort of useful or has been useful to you as a medical student, and a future doctor? Yeah,
absolutely. So I think one of the basic things it teaches you is criticality. You learn how to be critical with information. You think about studies and things like that have come out and are always being quoted in medicine and things, and you look at the data and go, okay, hold on, maybe it's not quite like that. Maybe I should read into this a little bit more, study graphs and things like that. The criticality of it all is very important, and is one of the key things that they try to teach you in intercalated degrees is how to look at evidence properly and say, maybe this isn't quite right, and really justify your beliefs based on evidence.
And when you then came back into medicine, was that difficult, coming back from something you'd left and coming back into it again?
I definitely saw a slight difference between myself, who had intercalated, and the people who came in from the year above who hadn't. Their memory of certain topics were a lot fresher than ours, but that was a very short-term thing. I think the extra year personally gave me that little bit extra confidence. I was a year older and had experienced more, so I felt a little bit more confident than if I'd just gone straight in from clinical years.
Okay, so if you had a couple of words of advice to someone who was contemplating being a medical student, which is 5-6 years of doing this before you become a doctor.
Yeah.
What words of advice would you give them?
So if you're contemplating being a medical student, make sure you absolutely want to do it. It is a long investment. Make sure you love the topic. Get experience outside. Go to shadow doctors, even shadow nurses, or any sort of health professional. You get the full picture of what it's like, and then make your decision.
And now that you've reached so far into it, you're still enjoying it?
Absolutely, yeah, loving it.
Excellent. Thank you so much for speaking to us, because I think that's some really valuable insight into being a medical student. So thank you very much.
Thanks.